Number question, you were somewhere and saw a guy collapse. You started CPR after checking the vitals and soon advanced cardiac support arrived at the scene. What should be the next step of management? Option A, hand over the patient to them and leave. B, ask them to apply the paddles while you continue CPR, and right option is B. 36 number question, what is the treatment for this fracture? And this is a case of patellar fracture, and right option is B, K-wire. 37 number question, a patient comes to the OPD with pain and swelling in the wrist joint. The X-ray is given. What could be the diagnosis? The diagnosis is giant cell tumor. 38 number question, a 2-year boy is presented to the OPD by his worried parent with the following complaint. How do you manage this patient? And this is a case of CTEV case, and this case is managed by, answer is posteromedial soft tissue release. 39 number question, a patient comes to the OPD with the chief complaint of pain and swelling in the right shoulder. A fracture of clavicle is suspected. What is the most common site of fracture of the clavicle? And the right answer is junction of lateral 1/3 and medial 2/3. 40 number question, what would be the probable diagnosis? And this is a MRI picture of spine, and the right option is port spine. 41 number question, which organism cannot be grown on a artificial culture media? The right answer is Mycobacterium leprae. 42 number question, a patient is presented with some unknown fungal infection. On histopathological examination staining, there is presence of sclerotic bodies having a muriform cell appearance. What is the possible condition? Condition is chromoblastomycosis. 43 number question, which of the following is the causative agent for the given clinical picture? Causative agent is Propionibacterium acne. 44 number question, a patient resident of Bihar came to the OPD with history of diabetes and complaining of multiple sinus draining foot as shown below. In the image, identify the condition. This condition is called Madura foot. 45 number question, which of the following is not tested before blood transfusion? And right here, hepatitis A. Right option is of this question is hepatitis A. 46 number question, a post-COVID patient presented to the OPD with progressive black nasal discoloration. Patient was diagnosed a case of mucormycosis. Which of the following can be provided as a therapy of this patient? Answer is amphotericin B. 47 number question, a patient came to the emergency complaining of fever, neck rigidity and pain since night. Analysis is showed elevated protein and neutrophil count. Diagnosis is bacterial meningitis. 48 number question, a person repeatedly wash his hands. Diagnosis is OCD, obsessive compulsive disorder. 49 number question, a patient presented in ward asked, what is your name? Patient repeat this same sentence, what is your name? This phenomenon is called echolalia. 50 number question, a female patient want to stop tobacco, what drug should be used? The answer is penicillin.